CT scan, MRI or X-ray. All these methods allow doctors to see inside the body, including inside the lungs, and make a diagnosis. We witnessed the future of medical imaging at the Clinic for Nuclear Medicine at the RWTH Aachen University Hospital. The facility uses a gamma camera that combines SPECT and CT imaging. We mainly use the camera for conventional diagnostics in nuclear medicine. This includes skeletal scintigraphy, heart disease, myocardial perfusion scintigraphy, and most importantly, lung diseases. In this case, it involves diagnostics tests for pulmonary embolism, which is very common. Professor Felix Motachi and his colleagues have worked with the state-of-the-art hybrid gamma camera since January 2018. The GE Healthcare SPECT CT system is the second full hybrid imaging system in clinical use in Aachen. The healthcare facility keeps up with the times. Patients are typically intravenously injected with a radioactive substance or inhale it for pulmonary test purposes. Unlike the injected drug dose, which is used to examine the heart, for example, the inhaled radiopharmaceutical quickly disperses inside the lungs, allowing the camera to record images very quickly. The camera rotates around the patient. This three-dimensional tomographic method uses multiple rotating camera heads to take tomographic images. There are typically 180 positions, always at 2-degree Haspler angular intervals. A SPECT CT scan of a body part will take between 10 and 30 minutes. The imaging system takes a SPECT and a CT image and combines the two images into a single 3D model, which offers unique benefits for lung exams. The distinctive approach allows us to combine different functions. We can look at the CT scan and check for abnormalities. Then we can check whether the SPECT scan reveals a conspicuous distribution in either the blood flow or lung ventilation. The double or triple information SPECT and CT provide permit an accurate assessment. Another important aspect comes from the additional camera software, which takes the lung anatomy into special consideration in the SPECT scan analysis. Imagine the lungs, which are divided into different segments. There are 10 segments in the right lung and 9 segments in the left, and this allows semi-automated segmental calculations. This enhances diagnostic confidence in the assessment.
Segmentabhängig dann tatsächlich einigermaßen halbautomatisch dann ausrechnen lassen, und so gewinnt man eine Sicherheit in der Diagnostik der Auswertung.
The nuclear medicine radiologists can rely on the correct diagnosis thanks to the two types of information the images provide. They show the structure of the examined part of the body and provide information about the way it functions. You try to get the best from what CT computed tomography has to offer, especially in terms of how the software processes the CT data, and combine it with the highest possible sensitivity of SPECT technology. This device combines this important aspect and makes this option available to increase the accuracy of the medical diagnosis, of course. When it comes to diagnostics, it's always critical to have high sensitivity, but also specificity to back up a diagnosis, which is considerably improved thanks to the hybrid data.
Und das kann eben durch diese Hybridinformation nochmal verbessert werden.
Having said that, Professor Motachi believes imaging technology hasn't reached its limit yet. Many medical advances keep focusing on radiation exposure to patients. This camera actually addresses this issue by giving off the lowest possible radiation exposure. Meanwhile, there are also attempts to head in this direction with magnetic resonance imaging, MRI for example. The same applies to diagnostic tests for pulmonary embolism because this yields a lot of information. However, a clinical application is currently still a long way off.